Hello everyone, my name is Marietta Fluellen and today I'll be presenting the JADA system. The JADA system is a device used to control postpartum hemorrhaging, and it was actually created a couple years ago during COVID in 2021. This, along with a couple of other medical breakthroughs, were missed back then due to society as a whole trying to navigate through COVID and trying to find our sense of what a new normal was. But a couple of other medical breakthroughs that were missed back during that time that I thought were interesting were rolling MRI machines, um, which are making stroke assessments a little bit quicker when you can take the device to the patient versus waiting for availability on the actual MRI machine. Um, there's also technology that's used to zap away prostate cancer, and there are actually blood infused sponges now that are helping with ACL tears. And as we know, that's a common tear within athletes. So I thought those were interesting. But today, like I said in my earlier introduction, I'll be presenting the JADA system. I would also like to include that one reason that I find this topic very important is because postpartum hemorrhaging is more common than we actually think. And there are many things that can contribute as a risk factor to postpartum hemorrhaging. For example, some risk factors are multi-gravity, so and multi-gravity along with multi-parity. So if you're pregnant, um, if you have multiple pregnancies and multiple births, that can actually increase your risk of developing a postpartum hemorrhage um, as part of a postpartum complication. And also, if your birth is augmented with Pitocin, oxytocin, um, that also makes you more vulnerable to a postpartum hemorrhage because Pitocin infusions, your body can actually um, only take so much of the infusion before it just doesn't work on you anymore. Some terminology that I may use throughout this presentation: uterus, a hollow reproductive organ located in the pelvic region of women; fundus, the top part of a hollow organ such as the uterus, stomach, or bladder; postpartum is the period after birth, marked by recovery of reproductive organs and structures such as the vagina, uterus, vaginal canal, and the rectum if necessary. Um, some women tear um, pretty severely that it can um, go down into the rectum. A hemorrhage is a quantitative blood loss marked by a 500 milliliter loss of blood for a vaginal delivery, so 500 or more for vaginal, and 1,000 milliliters or more for a cesarean delivery. Just a couple more terms. Atony is the loss of muscular tone. Lochia is vaginal discharge following birth, which is similar to a menstrual cycle, but it's not one. Lochia is actually the discharge that you get from your placental site. So the blood you see is not a cycle, it's just the blood vessels around the placental site that are closing up and trying to heal. Morbidity is an illness or disease. Mortality, of course, is death. And cervix is the opening at the end of the vaginal canal that leads to the uterus. To first understand how the JADA device works, we must first understand a normal postpartum course. In a normal postpartum course, you give birth, and then your muscle fibers from your uterus start contracting. Some things to help your uterine muscles contract is a fundal massage, and uteronic drugs such as oxytocin, which is synthetic pitocin, as well as Methergin. Those two drugs are uteronic drugs, and all that means is it helps those uterine blood vessels clamp down a little bit faster. Um, and of course, after the muscle fibers contract, you should start seeing a decrease in lochia. Not, of course, not right away, but that is the normal postpartum course. However, in a postpartum hemorrhage, those uterine muscles loses their tone and become boggy. In addition to that, those blood vessels become leaky, and so you're just really just pouring out blood from those blood vessels. They're not clamping down at all. They're not being constricted, so just kind of like you're losing, just kind of like pouring out blood from your bottom. So here is where the JADA system comes in, and some things that we should know about the JADA system. Um, I find it working similar to the Bakri balloon, which is an intrauterine pressure balloon used to put pressure on uterine vessels to control excessive postpartum bleeding. And to the bottom right here, you will see a picture of a Bakri balloon. And then the top is a picture of the JADA system and how it's used and its parts and structures as well. The JADA system is very much inserted into the uterine cavity, like the Bakri balloon is. However, whereas the Bakri balloon inflates in the uterus, you find that there's pressure, like a pressure balloon, kind of around the cervical area. And from that, the JADA system drains blood from the uterine cavity into a vacuum system. And in that picture up here, you can see the tubing that'll connect to the one of these valves in the JADA system, and it'll connect to your vacuum suction. And one of the things that's holding the balloon in place is just a sterile fluid, and that's pretty similar to the Bakri balloon. Down there, and here I inserted a short video of how the JADA system works. Just a short 35-second video, but here you see the JADA system being inserted and your pressure balloon being inflated, and from there the JADA system's kind of decompressing the uterine cavity and draining blood. In my research here, the JADA system is actually better than the Bakri balloon because you do not have to leave it in place as long, and it actually works 94% better than the Bakri balloon. Although the Bakri balloon is pretty effective in comparison to the JADA system, you have over a 10% increase reliability rate. I believe the Bakri balloon effectiveness is 87%, and the success rate with the JADA system is 94%. Some things that scientists were trying to address when developing the JADA system was, of course, maternal mortality and morbidity. From postpartum hemorrhages, of course, they're deadly if you lose too much of your blood volume. In addition to that, they can cause morbidity. If you, let's say, for instance, if you lose so much blood, let's say you weren't anemic before, but you lose enough of your blood volume during delivery, that can cause an illness such as anemia. So of course they developed this device as a more effective model or effective way to control postpartum hemorrhaging. And in this slide here, you can see that obstetric hemorrhaging is one of the top causes of death for the maternal clients. And of course, after that is maternal hypertension as well. In addition to identifying those who are at high risk for developing a hemorrhage after birth, that in combination with providing a quick way of evacuating that extra blood allow those uterine blood vessels to close more quickly, we should expect a lower rate of maternal mortality related to a postpartum hemorrhage. Now, the way that the JADA system was tested, and I'll be reading from my notes here, the trial enrolled 107 women 18 years of age and older with normal uterine atony and placentation who delivered at 34 to 40 weeks gestation. Before the use of the device, all had atony-related blood loss of 500 to 1500 milliliters or 1000 to 1500 milliliters following vaginal or cesarean delivery. Blood loss criteria were developed acknowledging the American College of Obstetricians and Gynecologists revitalized definition. The women that were involved in the study were around 30 years old, and all, 85% had vaginal deliveries, and the remaining 15% had cesarean deliveries. And that is how the JADA system was tested. And from using the JADA system, there was really no other surgical interventions that needed to be used following this. Of course, if you lose too much blood from your uterus, doctors will do a quick total hysterectomy to stop the bleeding. But through using the JADA system, none of that had to happen. And these mothers also had a pretty normal 6-week follow-up as well. As I prepare to wrap up here in a few minutes, one major conclusion that you can come to with regards to this device is that, or just this information in general, is that postpartum hemorrhage is pretty up there with regards to maternal mortality. And I personally think that this device will be very useful as it's implemented in more hospitals nationally and even worldwide to control morbidity and mortality in women. And although there are some contraindications and controversy of it, I truly believe that the good outweighs the bad with this device. So with that, you can conclude that I agree with the use of this system. Some contraindications of using it, however, are, of course, if you're pregnant, if you have untreated uterine ruptures, unresolved uterine inversion, cervical cancer, because that balloon does inflate close to the cervix, uterine anomalies, and purulent infections of the vagina, cervix, or uterus. And some controversy of the JADA system includes events that disrupted vaginal laceration repair. It may have led to bacterial vaginosis and vaginal candida infections known as yeast. However, those were the only controversial issues that were brought up to the JADA system. So scientifically, you can say that the good outweighs the bad from not only a personal opinion, but from a scientific one as well.